This is an introduction to the COVID Safe Space Calculator, a tool designed to help you create a space in which COVID-19 is not easily transmitted, that reduces the probability of your getting infected by the SARS-CoV-2 virus if it's in your area. And then finally, in general, how to just create a healthy, productive space for you to live in. What we see is on this front sheet is the main working sheet for the spreadsheet tool. There's inputs on the left, there's outputs on the right, and then there's a couple of other spreadsheets. But these are all understandable. You don't need to be a building science expert. You don't need to be a facilities expert. You just need to be a concerned person who would like to understand what makes a space safe. So as we look through this series, basically we want to understand the complex interaction of a variety of inputs, from those related to human behavior to those related to the operation and the occupancy of the building. And out of that interaction of inputs, we're trying to determine, relative to COVID-19, we're trying to determine the probability that if you're a susceptible person, you might get infected if an infectious person enters that room. And also the likelihood that an infectious person will be successful in transmitting that to more than one other person. When the infection multiplier is greater than one, that means that one infectious person has infected others. When we can successfully create a space in which the infection multiplier is less than one, and that is our major goal, when we get the infection multiplier less than one, and what epidemiologists and others in the field call R naught, but we'll call it infection multiplier. When that's less than one, the infectious person can no longer recreate the infection at a sustainable level. The disease dies away, and that's what we need in all spaces. So, is your space safe? Is your house of worship safe? Is your house safe? Is your business safe? Is your classroom safe? Is your restaurant safe? Is any public gathering place where you'd like to meet your friends safe? That's what we want to determine. That's what we want to provide you with the tools to determine. And again, you don't have to be an expert in this. You just need to be a concerned person who would like to understand. In addition, we want to know what's the cost of implementing these guidelines. And you'll be happy to know up front, it's not much. If you're making 25 bucks an hour, $50,000 a year, the cost to implement this is about a penny per hour. That doesn't sound like much relative to, say, an average wage or even a minimum wage. So the cost is not that great. And the productivity gains beyond that of stemming the spread of COVID-19, the productivity gains in terms of your health, your satisfaction with air quality, your ability to sleep, your ability to think, and the reduction of transmission of other illnesses like the common cold and flus that will benefit in those areas too. So here's how this tool works, just from an overview. It's meant to be the middle of a bunch of stakeholders, from administrators to customers to teachers to students to facilities people, but this is meant to get in the middle of all of them so that a reasonable, a rational discussion can occur over what makes a space safe. In a school, for example, the administrators, the teachers, substitute teachers, which are often elderly retired teachers, students and parents and facilities people, all of these have a stake in making this safe safe for themselves and safe for the others around them. And the COVID Safe Space IAQ calculator is meant to be that type of tool. If you're a restaurant, you may implement whatever guidelines, CDC guidelines, ASHRAE guidelines, but if you're just waving your hands and you're not able to tell people in a quantitative manner that I've done this, I'm doing that, and here's how this makes this space safe, you're not going to convince customers to come back. They're absolutely not going to come back until in some manner you can explain to them why this is a safe space. And if you're a business owner, whether a large business that has many stakeholders from office employees to suppliers to customers to administration to facilities to human resources, there's many, many people to bring into the discussions. This should not just simply be something that's a Hail Mary thrown over to the facility staff to implement. Other people need to be involved in these discussions to decide when and how the best path forward to reopening, to making a safe space occurs. And this is true whether it's this type of large business or a small one that's simply some office employees that have no customers, have no suppliers that regularly visit. Overall, we're all connected. Every space needs to figure out how to get the infection multiplier R naught less than 1. That is, how to make the space such that if an infectious person enters, it is unlikely that they are going to be able to infect someone else and keep the disease moving throughout. But this requires all of us in all of the places that we gather, all the places that we have to go, all the places that essential workers need to work. This requires all of these spaces to be defined in this manner. Now, this series is built upon several small YouTubes meant to be instructional, hopefully sometimes interesting, but most likely not, given my monotone manner of speaking. But up front, this introduction, a background, and then a little bit of a tour around the COVID Safe Space IAQ calculator. And then a series of small YouTubes that provide background. I didn't just grab these things out of the air. These come from many different sources, refereed journal articles, research reports, my own research. So it comes from many, many different areas, and it's built on science. It's built on evidence. We're still learning more, but we know a lot at this point to create safe spaces that will safely reopen. And so you can peruse these different articles as these YouTubes are posted in any manner as your interest dictates. And then a series of templates, a series of YouTubes. Is my house of worship safe? Is my restaurant safe? Is my gym safe? Is my office safe? Is my home safe? To provide you with the thinking that I go through when I design safe spaces, healthy spaces, and to give you the tools so that you can move through these in an efficient manner, but with understanding of why you're picking and choosing the inputs that you do. So thank you for joining me. Any comments, direct to me, Ty Newell at illinois.edu, and I'll try to answer your comments as well as respond to your criticisms anytime.